My name is Carlton Schaffer, and I had a stroke on March 17th, 2011.
And I'm Arlene, his wife, and we've been married for 45 years. We were having a discussion, and all at once, he changed. His speech was kind of garbled, and I would have to keep asking him, what did you say? What did you say? I couldn't understand him. And then I noticed that the right side of his mouth drooped, and saliva started coming out. And so I knew that there was something terribly wrong. So then I called 911.
I received him from the paramedics. They reported they had a low blood sugar, so I was intent on getting extra IV lines in him.
Just shortly prior to arrival in the emergency department, he had developed weakness of his entire right side of his body, slurred speech, and a little bit of a term of gaze preference where he could only look to one side. When I spoke to the consulting neurologist, Dr. Scalabrin, prior to getting Telestroke set up, she actually noted a very dense area on the middle cerebral artery, which was actually the clot. It's very small, but she picked it up, which was a good pickup, and agreed that this would be a good case to give thrombolytics to. So we kind of set up the Telestroke at that point so she could get some of the direct patient interaction.
His bed in ER was just surrounded by people. And then there was like a television screen there in front at his foot, at the foot of the bed.
I thought, this is strange. I thought I was watching a TV program. And why would they have me doing that? And then he said, this is your doctor. And she was beautiful. She was right there talking to me.
He was impressed that this looked like a big stroke, a serious stroke, and so I made the decision very quickly that we would shift the consult into a Telestroke consult over the camera, and I was actually sitting in this chair.
It's like a Skype TV with a little camera on top so that the patient can see the neurologist, and the neurologist can see the patient, ask him questions, and run through an exam and that sort of thing.
We were able to recognize right away that this was, in fact, a stroke, a fairly large stroke, one that would be quite devastating if not treated. The ER doctor was very quick to act and knew exactly what to do in terms of getting the thrombolytics prepared and getting them started.
She could see the size of the blood clot, and she said, we need to start thinning the blood, try to get rid of that clot. But she said, that clot is so huge that I don't think it's going to be adequate. So bring him in. And then she said, I recommend that you get med flight.
What it helped for me to be on the camera is I was able to notify our team on this side that the patient was coming from Florence in order to get the next procedure, which is to get the clot out mechanically. It helps to have both. So we start the clotbuster medicine there in Florence, and that loosens up the clot, so that by the time he arrives here, it's easier to get it out with procedure.
I knew at that point the patient was transferred from Florence, and then I was consulted that we've tried the usual methods of giving intravenous thrombolytic medication, which apparently has not been helping the patient. There hasn't been much improvement after that. So that's kind of where usually we get involved with more invasive and additional techniques that we can use to clear the clot. The Penumbra device is an end-hole catheter, so it's essentially like a suctioning device. It's a little catheter that we put into the clot. And clot, usually I tell people, it's sort of like a jelly at that point. It's soft. You can suction it. And then there's a little bit of a device that goes and kind of breaks the things, because otherwise it would kind of just get sucked on the end of it. And it comes in and breaks it apart and essentially suctions the clot. So it's a mechanical suctioning device.
Dr. Z was doing his best to try to get the clot out, but they don't always cooperate. And people are as different in disease as they are in life, and so things are always unpredictable. But I wanted to come out and let her know that where we were in the process, just because I know it's very difficult to sit there without knowing.
She said, "Oh, Mrs. Schaffer, it's not looking good." And so she went back, and I thought, we don't know yet. It's, they're going to try again to get rid of that clot.
It was probably almost 2 hours that I've been working on this and trying to suction. And it's not just a suctioning device. We also administer TPA, which is the thrombolytic medication, which softens and melts the clot, as I kind of described this. I've even used the RioPro, which is another medication that helps to melt the clot. And, you know, I've tried at least twice or more times to suction, and it did not clear. So I was losing sort of faith that we'll be able, because not always we can open it, but I was losing faith. And I remember Dr. Scalabrine was there for majority of the procedure. She actually left the room to talk to Mr. Schaffer's wife and to tell her probably what happened. To myself, I said, I'll try one more time. And that's when it worked. And then when Dr. Scalabrine came back, and I was just taking a picture, and she herself looked at it and asked, what did you do?
And when I got back into the cath lab, Dr. Z miraculously got the clot open. I told him I should have left a lot earlier. Maybe that would have helped. So it was actually nice because I got to give good news.
When she came out, she just was so delighted because it had been effective.
I called her my movie star doctor.
I knew that I was going to get him back, and it wasn't going to be as complicated as it would have been if they hadn't gotten that right side back.
You know, I think things went well. We did what we were supposed to do, but so many times things can kind of jump in the way and make you stumble. And this went well, so I was very happy to hear he had a good outcome.
There's no question that enabling me to establish that relationship early and understanding really what was happening to him really helped to get things done very efficiently along the way. And there's no doubt in my mind that it made a big difference in his outcome.
I'm just glad it worked. We are all very happy. That's all it's about. I'm glad he's doing well. So
Everybody is so encouraging, too, that sees him. They see, my, he's just done so well. And it's thanks to our wonderful doctors, the ones starting here at ER and then at River Bend.
I just hope I continue to get stronger so that I can get back to my regular life.